Hello, my name is Erica Parker. I attend Palm Beach State College. Today I'm going to be doing an assessment on a newborn baby. First off, we need to get permission from the parents and to help ID the newborn. We would also check for any newborn ID ban in that assessment. We need to get a little background of the newborn. We want to first start off by getting to know the birth mother. Did she have regular checkups while she was pregnant? Was she taking prenatal vitamins? Was it a high-risk pregnancy? And was she at any risk for gestational diabetes? Was the labor long and difficult? Was the baby born via vaginal birth or a C-section? Were forceps or a vacuum used? And is there any risk for infection? So after the baby is born, we first do a APGAR score testing. That's within the first minute of birth. The APGAR score is one of the first checks of your newborn baby's health. The APGAR score is assigned in the first few minutes after birth to help identify babies that have difficulty breathing or have a problem that needs further care. The baby is checked at 1 minute and again at 5 minutes after birth for heart and respiratory rates, muscle tone, reflexes, and color. Each area can have a score of 0, 1, or 2 with a possible of 10 points. A total score of 10 means a baby is in the best possible condition. Nearly all babies score between 8 and 10, with 1 or 2 points taken off for blue hands and feet because of immature circulation. If a baby has difficult time during delivery, this can lower the oxygen levels in the blood, which can lower the APGAR score. APGAR scores of 3 or less is often means a baby needs immediate attention and care. For the heart rate, if there is an absent heart rate, then the baby scores a 0. If it's below 100 per minute, then it scores a 1. If it's above 100 a minute, then the score is a 2. Normal heart rate for a newborn is 120 to 160. For the respiratory scoring underneath the APGAR, of course, if it's absent, the score is a 0. If it's weak, irregular, or gasping, then the score would be a 1. And if it's good and the baby's crying strong, the score would equal a 2. Regular respiratory rates for newborns is anywhere between 30 and 60 and is irregular. Next, for the APGAR scoring, is on the muscle tone. If the baby is just lying there flaccid, then the score is a 0. If there's some flexion of arms and legs, the score is a 1. And if it's well flexed and active movements of extension, with stimuli, the score is a 2. Reflex or irritability. If there's no response, then the score is a 0. If there is a grimace or a weak cry, then the score equals a 1. And if it's a good, strong cry, then the score is a 2. Color of the baby. If the color of the baby is blue all over, then the score is a 0 and get that crash cart. If the body is pink and the hands and feet, so the core of the body is pink, but the hands and feet are blue, then the score is a 1. And that's normal, most normal in a lot of newborns because it hasn't had time for the circulation to get all the oxygenation to all the limbs and things. And if the baby is pink all over, then the score is a 2. Now, if your baby scores 7 or better, then you're in the good range there. And of course, then you would reassess in 5 more minutes to see if it's gotten up to that 9 or 10 that you're looking for. If the baby scores anywhere between 4 to 7, then you need to be on higher alert for the baby, and definitely do that reassessment of the APGAR scoring with the crash cart in here. And if the baby is scoring less than a 3, you need that crash cart immediately. So now moving on to the head to toe assessment. Because newborns chill easily, we want to keep the baby partially covered, either with a blanket, or if you have the ability to do the assessment under a warmer, that is your best option. And we want to look at the baby to get a general overall impression. We want to notice the activity level. Are they awake? Are they alert? Are they sleeping? We want to kind of take notice of the muscle tone. Is the baby just lying there, or the arms and legs drawn up tight to the abdomen? Are hands clenched into a fist? We want to take notice of the movement and general symmetry of the baby. So here we also want to take a look at the skin color. We want to press the tip of the nose down lightly and release, and also the top of the chest, lightly and release. And if you were checking here for any signs of jaundice, it is considered normal for there to be a slight tint of yellowing within the first 24 hours after birth. But of course, if there's a darker color of yellow and it's lasted longer than 24 hours, then we do have signs of jaundice, and we need to be more focused on the bilirubin levels and things. Now we want to assess for the head. So we're going to remove the hat and we're going to be assessing the head. We want to first measure the circumference of the head. And we want to go just like this. Okay. Taking note. 30 centimeters. Okay. And later we will compare that to the circumference of the chest, because the chest should be smaller than the head. We now want to assess the head, looking for symmetry. We want to also assess the fontanelles. The anterior fontanelle, which would be like a diamond shaped, and you want to take note of, is it distended? If it's slightly distended, that could mean acute dehydration. If it's protruding or distended, that could mean increased intracranial pressure, and we want to make that a priority. Now we're going to check for the fontanelle at the base of the head. That's the posterior fontanelle, and that is that has a triangular in shape. Okay, and sometimes they will actually be overriding. This is considered normal. It's due to the trauma of the birth. So now we're going to be assessing the face of the baby. We want to take note of the cheeks. Are they full? Is everything symmetry? Is it symmetry when they're resting and when they're crying? We want to assess the nose, making sure that it's midline, that the nares are patent and that there's no drainage from the nares. Then with the glove, we want to use our pinky finger, our smallest finger, and assess for the sucking reflex. Okay, that's good. And while we're at that, we're just going to go ahead and put our finger at the roof of the mouth, checking for the hard and soft palates. Okay, and then we want to take note as well of the mucous membranes. They need to be moist and pink, taking note of any cracking. And of course, we want to look at the eyes. We want to look at the color, the shape, any swelling or drainage from the eyes. Are they symmetry with each other? Also then moving on to the ears, we want to make sure that the eyes line up with the tops of the ears here. And then now moving on to the ears. We want to take note Do they recoil right back as soon as, you let go? And then at that same time, we want to kind of assess for hearing. Do they startle when they hear a noise? Okay, so the baby can hear. And most hospitals, have you do a hearing check before the baby leaves the hospital. So now we're going to be moving on down to the chest. We want to go ahead and cover the baby, head back up to keep the warmth there. So now I'm going to be removing my gown here for the baby. And at the same time, we're going to be taking notice of the muscle and tendons and how they react to stimuli. Okay. So here we're going to be assessing the chest, checking the breast tissue. It's usually very plump and palpable, making sure everything's symmetry. We want to check for the xiphoid process, which is very prominent on newborns. Also going to be checking the neck. Is the neck able to hold up the head? Is it got full range of motion? Okay, so then we're looking on to the respirations that we will, we should be looking at the abdomen because newborns are abdominal breathers. So the abdomen should be rising and falling with the respirations. And again, normal respirations for a newborn are 30 to 60, and they are irregular. So now I'm going to be assessing for lung sounds. I want to listen to both sides, making sure that the lung sounds are equal. And then while I'm here too, I can just go ahead and auscultate for bowel sounds. And I want to listen to all 4 quadrants like you would in an adult. We also want to take notice if there is a umbilical clamp in place and it started to dry, it will start to feel like the tip of your fingernail. But we also want to take a look at the cord, noting if there's a 3-vessel cord. If not, there could be other abnormalities. Okay. Then we're moving on to also with the arms and hands. We want to place our finger in the palm of the hand, and the reflex should be that they should coil their fingertips around your hand. Now we want to keep the top portion of the baby covered as to hold in any heat that would be escaping normally. So we want to inspect. So we're going to be loosening the diaper. We want to inspect the genitalia for the male and or for the female. The testes should be present. They should actually be descended into the scrotum. You want to check for any scrotal swelling, which could indicate a hernia or hydrocele. Then for the females, you want to assess the labia majora. A lot of times that's engorged or swollen, and there could be some blood-tinged discharge, which is also called pseudomenses. And that's due to the hormones of the pregnancy, and that's considered normal. No interventions are needed for that. Okay, so then we also, at this time, we want to check the anus of the baby, and we just want to kind of turn the baby gently over. Now, if they've already had a meconium stool, which is the first stool of the newborn, either in the birth canal, which is not good. You want to assess them for any signs of aspiration of meconium. In that case, you want to suction the baby immediately. but also, you're checking for patency. So if they did have that first stole, then you know it's definitely patent. So as we're here, we want to check for any dimples, any scruffs of hair, any discoloration back there, which could be Mongolian spots. But with the dimple, that could also mean spina bifida. So after we have assessed the genitalia, now we want to move on to assessing the anus. We want to turn the baby gently over into the prone position. Here we're assessing the patency of the anus. If they've already had their first stool, which is the meconium stool, then we know that the anus is definitely patent. However, if they happen to have passed the meconium stool in the birth canal, we need to be a more focused assessment on the lungs. The baby should have been suctioned immediately for any risk of aspiration of that into the lungs. Next, we want to be assessing the sacrum area. We want to be checking for any tough scruffs of hair, any discoloration spots, which would be Mongolian spots, any dimples, which could indicate spina bifida, and then we want to focus our assessment in those areas if those were to be positive. While we have the baby in this position, we also want to assess for the spinal cord. So here we want to go from the base of the neck, the base of the head, and feeling downward of the spine, making sure that it is aligned and working. Now we want to assess for the spinal cord. We want to check at the base of the skull, moving down through the cervical area, just feeling this whole thoracic and everything, making sure that the spine is aligned. Then we're going to be checking for the folds to be equal on each side of both legs. We want to hold the legs together, and we want to match up both of the folds on each of the legs and making sure that they are equal. Then moving on to the feet. We want to assess the feet. Here we'll go ahead and roll the baby back over. Here for the feet, we want to make sure we have all 10 toes. We want to check the wrinkles on the feet. They should be going from the heel up to the base of the toes. And then we want to check for the Babowski reflex, which is where you just run your fingers across the sole of the heels up to the toes. And the toes should kind of flare out, and that's a positive Babowski reflex. Now we want to go ahead and redress the baby as to keep in any heat. And the baby's assessment, head to toe assessment, is now concluded.